Yeah, so welcome to Office Hours. Office Hours are a monthly offering that we provide for anyone who wants to learn more about gut health and nutrition. And it's just a chance for us to share some free educational information to hopefully help you feel better and improve your health. Hello from East Tennessee. I was in Knoxville yesterday, Marcy, so hello. We had a soccer tournament this weekend over there, and I stopped in Chattanooga also. So, hi, I was just in Tennessee. But yeah, so welcome. Today we are talking about the new dietary guidelines for Americans, and we are also going to be talking about a question we get a lot, which is what is the best diet for gut health? We had fun in Knoxville. We liked it a lot too. Okay, so yes. So the dietary guidelines for Americans, I'm not sure who has had a chance to look over them yet or what you guys have heard about them, but we are going to be going over those first. And one thing, let's see if I can go forward on this slide with all this stuff on my screen. Hold on. Um, let's see where I lost my, oh gosh. Oh, here it is. Okay. Cool. One thing, I don't know if you guys know this about the dietary guidelines for Americans, but one thing that's really interesting is that they come out every so often and they change them. So every 5 years, things look a little bit different, and every 10 years, there's a new edition that's put out for the dietary guidelines for Americans. And there seems to be a different focus each and every time. So as dietitians, we've been kind of following this along throughout the years. And the most recent ones released look a lot different than ones in the past, which I think is probably a good thing. Um, the new dietary guidelines for Americans have a higher focus on things like protein, dairy, healthy fats, fruits, and vegetables, and they're really big on eliminating ultra processed foods or avoiding them as much as possible, which we feel is a positive change. So we'll look a little bit at exactly what they say, but if you guys remember from years in the past, the food guide pyramid, this is kind of the food guide pyramid flipped upside down, which is pretty interesting. So what we have here is this year the focus is really high on protein. It's about getting the right amount of calories to help manage a healthy weight, and that I think fits pretty well for our country. There's a lot of people out there who would be healthier at a healthier weight. It focuses on dairy, 3 servings a day of that, which hasn't really changed. Fruits and veggies, it recommends a minimum of 3 vegetables and 2 fruits, which we agree with, but we could even put this higher, always more vegetables than fruits. And if you wanted to take it a little further, you could even go organic fruits and veggies, 3 and 2 servings a day if you really wanted to up level your game, but definitely hitting a minimum of 3 vegetables and 2 fruits, focusing on healthy fats, and then limiting the processed foods, added sugar, and refined carbohydrates. So those would be the ultra processed foods. Um, the type of food that if you're looking at it and you can't recognize what's on the ingredients list, it's the kind of thing you would want to stay away from, really. Um, so thinking about that, like what is it that you're putting in your body? Where did it come from? Did it come from the earth or did it come from a manufacturing plant? Um, Thinking about food that way, like getting closer to the food chain. And then always solid advice to limit alcohol. It's inflammatory. And when we're thinking about gut health, it wipes out the microbiome, both good and bad bacteria. So that's something that we really want to be mindful of and I think fully back all the time. Um, where I feel like we are really in alignment too. And one thing that did change too, the protein recommendations are higher now, closer to a pound of protein, or sorry, a gram. And everyone talks about proteins in kilograms, which we don't really use. But basically, if you wanted to keep things simple, it would be our recommendations and closer to what these guidelines are leaning to is a gram of protein per pound of body weight or per pound of ideal body weight if you are looking to lose weight. And, getting close to that, I think in our clinic, like we would strongly all agree on a minimum of 80 grams of protein a day, depending on what your goals are. We don't want anyone eating less than that because protein does play such a big role in maintaining muscle mass. And even if we're limiting calories to lose weight, the one place we don't want to cut back on too much is the protein because we never want to compromise our muscle mass for the sake of calories. Protein also plays an important role in regulating blood sugar, which is really important for maintaining a healthy weight. And it also helps you feel satisfied. So just kind of a quick, like off the cuff thing here, when we're talking about healthy eating and looking at these guidelines, if you really want to get savvy with food, like the best way to eat would be to eat your vegetables and then your protein and then your carbohydrate. If you're looking at a meal, that's for ideal blood sugar regulation. You'll feel more satisfied and when you metabolize those carbohydrates, you'll have less of a blood sugar spike. So there's lots of different levels we can take these. We don't want to overwhelm you at all, but just depending on where you are, there might be goals that are easier for you to achieve or places where you could even level up and unlock something new and like super impactful. So yeah, just think about that. Like definitely no less than 80 grams of protein per day, adequate calorie intake. If you are cutting calories for weight loss, don't sacrifice the protein. I'm fine with 3 servings of dairy a day if you tolerate that well. A lot of times when it comes to gut health, people don't if they're compromised. So looking at dairy, there's lactose issues. Sure, that's kind of like surface level and simple, but there's also the whey and casein components that people can react to. So just kind of thinking about this combined with gut health, it's an interesting, like really nuanced. But if you need to try cutting out dairy to see if that solves digestive problems, or if you don't tolerate dairy well, I would say that's okay too, because there's lots of other places that you can get the nutrients that dairy provides, calcium and protein being the main ones. Yeah, and then 3 veggies, 2 fruits. If you want to up level that, you could do like maybe 5 vegetables and 2 fruits, if you have room to improve there. Healthy fats, we're talking avocado, we're talking olives, we're looking at those oils as well. So Erica, you can jump in on this if you want, but the 3 oils that we use in our home to cook with, well, I would even say, there's probably 4 sources of fat that you'll find in my pantry and refrigerator. It would be avocado oil, that's for your high heats. Olive oil is for like low heat marinating and salad dressing. You don't want to ever heat oils to the point where they're smoking because then they become actually carcinogenic. So this is a simple takeaway to you guys. Like, depending on the oil, depends on what you do with it. Coconut oil is another like low heat oil that you can bake with. That usually works pretty well in that situation. But the other fat that we would use to cook with too would be butter. So it would be avocado oil and olive oil for cooking, avocado oil, high heat, olive oil, low heat, and then butter as well as coconut oil. Again, that's a low heat, and that would be more of like a baking situation. Erica, do you have other ones that you like to use too, or are you the same as me?
I'm exactly the same as you. Sometimes we have people with food sensitivities and we really have to get creative. So I've already used random things like walnut oil or, flaxseed
Mhm.
oil or things like that. But in general, I do exactly the same thing that you said. I think sometimes people stay away from butter thinking about the saturated fat. It's really about using them all and where appropriate. And butter is actually really high in butyrate, which is one of those things that feed our good bacteria. So when we think about our foods, we're always thinking about how are we feeding our gut and those bacteria specifically. So there's benefits to all the different ones.
Yeah, absolutely. Yeah, so just some practical applications there. Smoke point is really important with oils. We don't want things to become carcinogenic. I feel like every chef ever on the Food Network is cooking with olive oil at 425 degrees in the oven, and it drives me insane. That is a no-no in the nutrition world. So just
Yep.
swap it out for avocado oil. and it makes a huge difference in terms of your health and inflammation.
Another
Um,
really big thing with the oils is some
yeah,
people will have them in their cupboard for a year without
yeah,
using it. They go
yeah.
rancid really
Hmm.
fast. So you do want to use up your oil pretty quickly and get rid of it if it's old.
Yeah, yeah, I totally agree. Um, Yeah, and I would say, we're really in alignment with a lot of these guidelines. I think there's room for improvement and nuances depending on each person and what they're struggling with. But what we love the most, I would say, is, the focus on real food and fewer ultra processed foods. And they really did call that out, which I love. Prioritizing protein is newer. Like we said, that helps with appetite regulation and steadier energy. And then they did give an acknowledgement of fermented foods, which I think is really cool. So fermented foods would be things like sauerkraut and kimchi, where they're foods that naturally contain probiotics. Yogurt would be another example of a probiotic containing food. Kefir also. So trying to consciously consume, like a tablespoon of fermented veggies a day or a serving of a probiotic rich food can do wonders for your gut health. So that's another really important thing that I thought was really cool that got some recognition with these guidelines. Things we didn't love so much, they did give like a blanket 10% limit on saturated fat, which all of this is going to be nuanced, right? So the dietary guidelines for Americans are written more for an institution level. So where we'll see real changes from this that I think is exciting would be schools, hospital cafeterias, anything that's influenced by like federal funding or looks to the government for guidance on their menus. So like senior living facilities would be another example. I think even like the like jails and prisons, like federal institutions. Certainly too, USDA will be like referencing this for like what they're doing and what they're putting out to places that fall under their guidance. So it's really cool to have these kind of more in alignment with a truly healthy diet. But when we do that, we also can oversimplify things because this is a truly a one diet fits all mentality and like ways to improve things for a large population. So when it comes to individuals, a 10% limit on saturated fat isn't necessarily correct or for everyone, but it can be a good guidance for like a larger institution. But if someone doesn't have a risk of heart disease, or isn't, necessarily trying to lose weight, I don't know that they need to cut back on fat in their diet, but it is out there as like a blanket recommendation. Erica, did you have anything on that one?
I'm again in complete agreement with you on that. And I think this is where it gets really confusing for people that it makes me think back to like eggs are bad. They're really high in cholesterol. They make your cholesterol go up versus, what it is really nuanced. And some people are more sensitive to saturated fats based on their genetics. Some people have to watch these different things. Some people have just food sensitivity. So it's very hard to give these blanket recommendations like this, but the saturated fat being that high is seems a little risky to me.
Um, and yeah, and we did this today, but you guys, they don't do this in the guidelines, just guidance on fat quality and cooking methods. So like, oxidation, like we talked about, smoke points, or how different fats behave when heated does affect your metabolic health. And it's really important to be aware of, how to use which oil correctly and when to use it. And then, I mean, we're very biased, but I don't feel like gut health got a lot of emphasis. So I would have just put a little more emphasis on the importance of fiber specifically and the importance of all things, having a diversified sources of fiber. So that kind of comes into play when they're talking about three vegetables and two fruits a day. But if we wanted to up level there, again, maybe aiming for 5 vegetables and 2 fruits a day, you would get a variety of fiber. But I think for people kind of just having the knowledge and awareness of how that ties back into gut health is really important. But honestly, guys, like if we could all get on board with just eating actual, like real food that isn't processed and being really intentional about having a serving or two of vegetables at every single meal, the health of our nation and just even on an individual level would just drastically improve. And hitting those protein goals, I mean, there's a lot of really simple things in here that everyone can do at home that would just make the biggest difference in how you feel and how your body's metabolizing food. So, all in all, like I personally am really excited about the new guidelines. I think that it's going to be really interesting to see what a big difference they're able to make in the next few years as these things get implemented. The other thing that this is going to influence is marketing on foods, but also hopefully ingredients lists. Hopefully, we'll see those kind of shrinking down some and really having like more, it's not like we can get away entirely from processed foods. Let's be real. But maybe on the processed foods that are out there, we'll see more recognizable words on the list of ingredients included and hopefully pare down on some of the preservatives and things that we know are not good for health, but are, still present in our food system.
I think one simple practice is just doing a food diary for a couple days to really see what you are eating. I can't tell you how many times when we start talking to clients, we're like, "Oh yeah, I love fruits and vegetables. I like all this stuff. Yeah, I eat them." But then when they actually record it, it's like, "Wow, I guess I am actually short on these levels." So it can be a really good awareness tool to just write down for a couple days what you actually are doing.
Yeah, absolutely. Okay, so Erica, I'm going to go do the right way on here. All right, go ahead.
So, and I see a bunch of friendly names on here from our webinar. So some of this might be repeat, but I don't think we can say these things too often. And some of this will be like a summary of what Jenny has already said, but really there is no one perfect diet for gut health. There are so many times where you hear your neighbor did this diet, it worked really well. Another person did another one that worked really well. It's because we're all really unique and we all have a unique way to eat. It also depends on the symptoms you're having. So this might be a big clue as to how we design a diet for you. And it really is more than food rules. I try to get people away from seeing foods as good and bad. And it's not about these rules, but maybe there are some boundaries in the beginning just to meet your goals.
Sorry, I don't know.
Next.
It's me. I'm sorry. It's clicker.
Okay.
There. Okay.
So we talked about this too. So hopefully you remember this. Before you even talk about the food choices that you're having, we need to know and discuss how often you're eating. So if you're snacking all throughout the day, you're never giving your gut a chance to rest. Do you eat slow? Do you chew your food? Are you eating on the run? Are you in a stress mode? All of those things really matter for not the food you're choosing, but if you're having all this healthy food, you got to make sure your body can handle it and break it down. So we start with the physiology piece, not necessarily restriction. So this is, I think, a good way to maybe summarize the things Jenny was saying and put it in a way that you can see it more tangibly. So protein at every meal. We're not talking get your 90 grams in one meal. Protein is really hard to digest and spacing it out really matters. The body can only handle so much of a load of protein at one time. So aiming for more of the 20 to 30 grams per meal in general. Some people need to go a little higher. And the reason for protein, it's repairing the gut lining. We need really high protein levels for any time we're healing something. Jenny mentioned it stabilizes the blood sugar and it really helps reduce cravings. Color and diversity. If people ask us one thing that you can do differently, it's diversify the foods you eat. So, rotating vegetables, focusing on herbs and spices, those are actually really good for the gut microbiome as well. And then for some people, certain high fiber foods can be really difficult to digest. So, while we're working on healing, sometimes it's focusing on variety over volume. You might only be able to tolerate so much or make sure that they're really well cooked. I also see people go all in, on the in the new year with this really healthy diet, but they went from pretty much zero fiber to all of a sudden this huge load of fiber. That can be really hard on anybody's gut. So not necessarily jumping all in, but slowly increasing fiber, starting with well-cooked veggies and then increasing over time and seeing if you have any digestive upset from it. And then healthy fats, they come from more things than the oils we talked about, nuts and seeds, fatty fish. Oils or fats compete with each other within our body. So when we eat too high of the processed foods, it's going to compete and outrule all of the good fats that you potentially are eating. So it's just as important to cut back on those processed fats as it is to incorporate the good healthy fats. And this could be a clue for some of you too. If you have large heavy meals, like if you eat a lot of fat and it doesn't go well, either you get reflux or diarrhea, you definitely have some digestive things going on. Either you're not breaking down the foods well, there's a mismatch in signaling, liver, gallbladder. There's so many things we look into when we see this being an issue.
Yeah, and I just want to say, like, if you guys are struggling with digestive problems, especially diarrhea, just cooking your veggies can make the biggest difference. And then if you do have diarrhea and you ever notice there's oil floating on top of the toilet water, that's a really good sign that you might have a lipase deficiency, which is the enzyme from the pancreas that breaks down fat. So if you're missing a gallbladder, you should book an appointment with us because we can help you figure out what supplement to put in to help with the function that that was once giving you. I will say this, anyone without a gallbladder absolutely needs to be on digestive support. Um, the gallbladder stores bile, the liver makes it. So if they remove the gallbladder, they'll say it's okay. Like you're still having, producing bile, like you don't need anything extra. But the gallbladder is really unique because it secretes the right amount of bile at the right time, like in a specific way to help with digestion. So if you're missing that, even though your body's still producing bile, like you do need that extra support. It definitely helps. One or two sessions with us, if you don't have a gallbladder, will completely change your digestive health around. So that's really important. If you know anyone on the gallbladder struggle bus with digestion, this is key that they need some support and a little bit of guidance. So yeah, sorry to go off on a tangent on that, but that's just kind of where my brain went this morning. But yeah, and also, yeah, just paying attention. Like if you see oil floating on top of the toilet, you definitely need some digestive enzyme support, specifically probably lipase, but maybe even just a well-rounded um, enzyme would be really helpful. So just kind of a pearl there for you guys if you're struggling.
So these are really common mistakes that we see people doing. Over restricting is one of the biggest ones. As we keep restricting, we keep changing our gut bacteria, making it more difficult to digest, and then you're able to handle less and less foods. So our biggest goal is helping you expand your food list and getting more things that you can tolerate. I also see people jump diet to diet really quickly without maybe giving it a chance or fully understanding it. The low FODMAP is something we know very well. It's not for everybody, but we can also help with the nuances of that and even expanding on the foods that you can have within low FODMAP. Ignoring digestive issues, those signals are a gift from your body to help tell you what's going on. And when people only focus on food, they don't look at their stress level, they don't look at the volume of food they're eating, how they're chewing, all the pieces matter just as much as the types of food. And then really personalization does matter. Someone with SIBO should not be eating the same diet as someone with colitis. Reflux is not the same as constipation. Really looking at that root cause is going to be the best way to help figure out what diet is best for you.
Oops, I think I went. Hold
And
on.
then,
Sorry, I
yeah,
went too many. Okay.
no, that's okay. It's just if you don't know how to figure this out, you are not alone. And there are a lot of people that are just very confused about the best way to eat for them. And this is exactly what we do. So, personalized testing, strategic food plans, and then that step by step guidance. And on this next slide, I just wanted to show you. I know it's really tiny, but it should just give you appreciation for all of the information we see on just a stool test. So things that we're looking at, how are you breaking down your foods? Are you breaking down your foods? Do you have the right amount of enzymes? Is your immune system causing some of the issue? What are the metabolites that your gut bacteria are making? All of those things are really important. Then we jump over to the different strains of bacteria so we can see if things are overgrowing or undergrowing. All of that gives us ideas of maybe the way to eat. You know, a pattern can show us what's exactly going on and why you're having those symptoms. A really big piece is these next two that I like about the GIFX so much is because they actually culture out your stool. They see what grows, how strongly it grows, and then they test it against antimicrobials. So these are things that supplements that can reduce or kill off excess bacteria. So we know the best unique protocols for you. So this is just such a cool test. It gives us that unique look into what's going on in your gut.
Yeah, there is nothing else like this test. And what I always say I really love about it is you could, if you didn't know if the patient that you're working with on our side, you could paint their picture from the test results. So to me, just the fact that the symptoms always mirror what the test says just is so validating. We know this test is accurate and we know that it really helps people when they get these test results and we can put them through protocols that are based on the test results and their symptoms. But it's just such a good feeling as a practitioner to be like, yes, this makes sense. This, what this is saying totally fits this person's picture. So I love that.
Does anybody have any questions? You're either welcome to just unmute yourself or put it in the chat. Here, where are you located? Our corporate office is in Atlanta. We have a lot of patients there, but we do everything virtually. So we work all over the place. I personally, I live in Wisconsin. Another one of our practitioners is in South Carolina. So we are all over and can see people all over. Genova testing, they have different tiers. There are different Genova stool tests. I think you might be talking about a gut healing strategy session or our Restore Gut Health programs. We have 3 different tiers for those programs. And that's why we usually do a gut healing strategy session first, because then we customize it to you. So some people just need 3 months of support and like 2 or 3 tests. Other people really need more of that 6-month sort of support. And there's more testing that's involved there. So it kind of depends per person. And during your gut healing strategy session, we would go over which one is best. If you need to talk more to Catherine about that, we can also set up like a 15-minute call to go over more in depth or any follow-up questions, because I know it's a lot to go over just in that 1-hour time frame. So we'd be happy to follow up with that too. Any other questions? I really appreciate everybody being on today. And for those of you that have been to both of our recent sessions, webinars, that's really amazing to see. We have so much to share, and we do monthly sessions like this just because there's so much to learn. Our body changes. Yeah, it's pretty phenomenal. There's no actual office. So that's everything is virtual. Once COVID hit, we turned everything virtual and it's worked really, really well. So it'll be a video call. I have felt I was really skeptical too on how it was going to be without being in person, but I haven't found that it decreases the value or makes you feel less connected in any way. So unfortunately, we don't have an actual office if that's what you're looking for. We did answer the question about fermented foods. That's one that can be really tricky. I've had some patients that are like, "Oh, fermented foods, it's great," and then all of a sudden they eat so much sauerkraut and then feel horrible. You do need to go really slow with fermented foods and see how your body does. Trying to just ramp it up really quickly, just like fiber, it might not be the best idea. Yeah, John, I saw you were really active in the webinar as well, and I saw you mention Wisconsin in the webinar, and yes, we live really close. All right. Anything else anybody has? Otherwise, this recording will go out, so if you want to repeat listen to any of it, it'll be available for you. But otherwise, we'll see you next time. Great. I'm glad this was helpful. All right. Everybody take care. Have a great day. Bye bye.